motion to approve the consent agenda?
So moved.
Second. Favor say aye. Opposed, no. We have the board quality report. Ms. Hamilton.
Thank you, Dr. Cannell. Tonight you'll have your full quality, both your quality dashboards and also the minutes from our August board quality meeting are all in board effect for your review. As far as our quality dashboards, we'll see that we still have seen positive trends in our 30-day readmissions and our healthcare acquired conditions over the last several months. We are currently exceeding 5 of 7 of our patient satisfaction scores for this fiscal year compared to our previous fiscal year. And we're also continue to see a nice linear trend and decrease of left without being seen from the emergency department and also just overall length of stay in the emergency department for patients that are being discharged home. And then tonight I wanted to try my best to simplify a very complicated process around quality reporting and different incentives that CMS has. So there's several different programs that you'll be exposed to, that you'll hear about, and I wanted to just kind of bring your attention to some of these and just give you a good foundation for whenever you're looking at your quality dashboard and the metrics that we're tracking, to kind of see how those are prioritized and what incentive programs that we have through CMS particularly. So there's 3 different types of programs. There's compliance-based payments, there's penalty-based, and then there's incentive-based. And so I'll just quickly go through each one of these. So first is your inpatient quality reporting, and that is where basically hospitals are submitting data to CMS, and you are penalized if you fail to submit that data. And then next is your hospital acquired condition reduction program. And what this does is that there are 6 different healthcare acquired conditions, and the lowest 25%, the lowest performing quartile, 25% of hospitals that fail to avoid these conditions receive a 1% reduction in their CMS payments. And so these are the 6 different measures. There's a PSI 90 measure, and that is basically a roll-up composite measure of these 10 different domains. And then you have your CLABSI, CAUTI, surgical site infections, MRSA infections, and C. diff. And so you'll see a lot of the times I talk about, how we're performing with these and what our focus areas are, and those are also reflected in your quality dashboard. And what happens is there are these 6 measures. However, there's a threshold that you have to achieve with each one of these. So for smaller hospitals, if you have a lower volume, you will not meet a threshold to report certain measures. So for example, like surgical site infections, you might not have a high enough denominator for that to count. And so what happens is that then your other measures count even more. It just redistributes that weight to those other areas. So like I said, the lowest 25% of those hospitals will receive a 1% payment reduction. And so what are the things that we do to prevent, I talk about these a lot, but one important piece is just making sure that we are identifying these conditions that are present on admission, because if you do not identify them on admission, then they are considered hospital acquired. So we have multiple programs in place to make sure that we're getting, skin assessments completed, that we're doing testing timely to identify those conditions that are already present. And then we have just evidence-based protocols, bundles, order sets that we use for preventative measures. So, for falls, for pressure ulcer prevention, I already said about timely testing, and then just different evidence-based bundles for pneumonia, sepsis, related to surgery, and then nurse-driven protocols for catheter care, so for central lines, for Foley catheters, and also to expedite the removal of those devices when they're not indicated. Okay, and then the next penalty-based reduction program is around hospital readmission. So it's called the Hospital Readmissions Reduction Program. And what this does is it compares hospitals with other hospitals and how your readmission rate compares to them for different diagnoses. And you can receive up to a 3% reduction based on that performance. So these are the 5 different diagnoses that they look at. So acute myocardial infarction, heart failure, pneumonia, CABG, so coronary artery bypass graft, which we do not do here, and then elective total hip and total knee arthroplasty. And so you may perform better than some hospitals for one and worse for others, and so that's kind of where you can get that range of 0 to 3% reduction. Excuse me. And so, what are some of the things that we're doing around readmission prevention? I talk about this a lot as well. We have streamlined discharge planning, very intentional processes for discharge planning, making sure that we have good education for chronic disease management, and making sure that we're linking patients to those resources that we have to help manage those conditions after they leave the hospital. Focusing on patient and family engagement, getting those patients and their families involved in their care, in their education. This is hard to see here, but that says medication reconciliation. We've had a big program, a big project around that over the last several years. Follow-up appointments are also very important, so making sure that those appointments are scheduled for the patients to see their primary care providers and specialty care providers when they leave the hospital, and also facilitating transportation or any barriers that they may have to go to those appointments. And then we have our readmission task force that meets once a month so that we can make sure that we're really optimizing the coordination of care between all the different aspects of our organization and making sure that we're utilizing all those resources for our patients. And then the last one here is the most complex. It's called the Value-Based Purchasing Program, and this one it can be penalty or incentive-based. So you can have a plus or minus 2% reduction or earn up to 2% based on your performance. So the lower performing hospitals can have up to a 2% reduction. The higher performing hospitals can have up to a 2% earning in addition. So how that program works is that there's 4 different domains. They are each weighted 25%. This first one here is safety. So that's going to be your healthcare associated conditions again. So your CALDI, C. diff, CLABSI, surgical site infection, that PSI 90 composite measure. So not only could you be penalized from a healthcare associated condition program, but you also could be penalized again for it here. You're going to see some of the same things showing up in multiple programs. And then for your clinical outcomes, these are going to be 30-day mortality rates for specific diagnoses and complications related to total joint replacements. And then you have person and community engagement, and this is going to be your HCAHPS performance, your patient satisfaction surveys. And then this one to the right here is efficiency and cost reduction, and that is MSPB is Medicare spending per beneficiary. So that's just an incentive for cost control and cost reduction. So in general, just considerations with all of these different programs is that there's a significant time lag. So what payments we have right now are reflective of performance we had 2 years ago. How we're performing right now will be reflected in payments 2 years from now. And small hospitals are impacted by minimum threshold requirements. So that's kind of what I said, that you have to have a certain threshold of volume for each of these measures. So if you do not meet that volume, like some of these smaller hospitals, then your weight is just distributed to even higher to some of those other areas. And then they have recently made some adjustments based off a percentage of dual eligibility patients. So just trying to bring in a health equity kind of adjustment to recognize the different populations the different hospitals are providing care for. And then just general keys to success for these programs is making sure that we have engaged frontline staff, physician buy-in, leadership support through our board and executive leadership, ensuring that we have hospital goals that prioritize these different areas, which we absolutely do throughout our organization, and having data outcomes at the unit level. So we have this through our different department-specific quality reports that each area has department-specific outcomes that they are looking at that drive these measures at an organization level. And then real-time feedback. So like I said, you're looking at sometimes data lags of 2 years. So we make it every attempt possible to get real-time data so that you know in real time how you're performing. So if there is an area that needs improvement, you're aware of it and able to tackle it now, and you're not looking kind of in the rearview mirror 2 years back and then realizing that you have something that you need to work on. So it's very complex. There's a lot of methodology and risk adjustment into all of these programs and different metrics, but I just want to kind of give you a brief overview of what they are so that whenever you're exposed to these different topics that you kind of have a general idea of, you know, what they are, and you can interpret your quality reports based on some of these measures. And then the last piece that I wanted to talk about is around star ratings, and that's something that you hear a lot about through CMS star ratings. And what they did is, with CMS, there's over 100 publicly reported quality measures. And so they developed star ratings about a decade ago in an attempt to simplify all of that information for consumers, so how they can interpret all of those measures. And again, this is very complex, and I'm going to make it as simple as I possibly can, but just to give you an idea of how these come about. So of all of those publicly reported quality measures, they pull out about, I think it's about 46 of them, and they're grouped into these different areas. So mortalities, which you also have seen in some of the other programs, safety of care, that's going to be your hospital-acquired infections, readmissions, again, you've already seen that, patient experience, that's your HCAHPS scores, and then timely and effective care. And there's different weights, 22, 22, 22, and 12. And so what they do is hospitals will meet a threshold to be able to report enough to either meet 3 of these, 4 of these, or 5 of these. And you'll see that most hospitals, 78% of the hospitals, actually are able to meet the threshold to report out 5 of these different measures. So then of this group here, they have a bell curve that distributes 1, 2, 3, 4, or 5 stars. So most of your hospitals, the majority is going to be in that 3-star range. And that's kind of like your average performance. The more above average performance you have, you're going to get more into that 4 or 5-star range, and then just the opposite. So it's very, very complex. Again, there's a lot of risk adjustments and different methodologies, inclusion and exclusion criteria. But the one final thing that I wanted to say is, right now, it's kind of cut off right here, but the 2023 ratings have data in all of these different areas that go back from July of 2018 all the way up to March of 2022. So that's how big of a span of data is pulled into the current star ratings. So it's just, like I said, it's just very complex, and you're compared to all the other hospitals. So it's not like when you're in school and if you get an 80, then you have a B. If you get a 90, you have an A. There's not really a predictive value whenever it comes to star ratings. Like I said, it's a bell curve, so you're being compared to everybody else. So I hope that kind of simplifies a very complex just a whole process. But this is specific to hospitals and CMS. But different payers, different settings have similar programs. So home health, long-term care, they all have different star ratings and also value-based purchasing programs. Any questions? Okay, that's all I have. Thank you.
I have just a comment. I think that this hospital has been on a pretty amazing path, if I go back to 2016, 2017, in terms of quality improvement. And particularly, I know that readmissions were a place that was focused on back in 17 and 18. And of course, that COVID created a little bit of a blip in it. But we've still been focused on showing improvement in readmission, anything related to readmission penalty, any penalties, we've seen those decline over to, I want to say it's less than 1%. Actually, I think we're better off than most facilities around us in terms of our overall performance on these metrics. So I think we're going in a great direction. I appreciate the medical staff has been very helpful to us, obviously, in moving metrics along.
Thank you, Jeannie.
Thank you.
We have Dr. Ricky Stevens has the medical staff report, please.
Sir, thank you, Dr. Cannell. For reappointment, we have Jessica Hart at the Wound Center, and for new appointments, we have Dr. Cost, who will be OBGYN, and then for consulting, we have Dr. Gupta, Dr. Fan, Dr. Kazaa, and we also have nurse practitioner Megan Broadwater, who will be a mid-level in the emergency room. Those come as a recommendation from the Medical Executive Committee.
I have heard the recommendations from Dr. Stevens. We have a motion to approve.
ahead, okay, sorry, I'm getting hard of hearing. I think you have in your board effect, you do have all the slides from, the month of August for the board presentation, as well as the finance, slides that were, presented to the finance committee. But August, we were about 98% of budget for our gross. We were at 100% for net revenue. Unfortunately, our expenses for the month of August were about 104% of budget. Year to date, we're running at 96% for gross, 98% for net, and our expenses are right on track at 100%. We did see lower admissions last month in August, about 4% over last month. They were about 10% lower than last August. If we look at year-to-date numbers, we're about 1% off from the previous year. One positive thing is our average daily census was down, but a lot of that was due to all payers, Medicare, Medicare HMO, and Medicaid length of stay being lower than it was last month. It was also much lower than it was last year. We continue to work on that as a team, and collaboration is really starting to pay off. Now, we won't continue just to keep seeing it go down. There are going to be months where we do see it go back up, but collaboratively, we're getting more and more consistent with working on those average length of stay of our patients. The ER was up about 1%, but compared to last August, we were down 4%. That's 2 months in a row that we've been down compared to previous months. Outpatient visits were up significantly over last month, and about 1% over last year. We saw about a 29% increase in surgeries from the previous month, and about a 7% increase from last year. You can look at the nursing homes. They continue to increase their census, whereas CareSouth also has increased since last year. The other thing is, you can see there wasn't hardly any supplemental payments in the month. We continue to be so grateful for Georgia Heart. You have those numbers in your slide deck, but continue to be very strong for us and very important for us as an organization. We have received notification for the Medicaid hospital-directed payment, which I think I might have mentioned that I might have gotten notification of that right when we had our board meeting last month. But we did make that transfer on September the 8th, and we will be getting that back on October the 13th. And remember, that's where the state helps compensate some of that Medicare business to a Medicare rate. I want to remind everybody in the public that Medicaid unwinding or revalidation of that service is still going on, and it is still going on very strong. We are seeing lots of people come off the Medicaid rolls, and a lot of it is not because they're eligible, it's because they're not going through the process to revalidate that eligibility. So if you do get something, please go through that process. If you're unsure what to do, we will be happy to help you walk through that process. You can call our financial counselor, Melinda Allen. Her number is 276-3128, or just call the main number and ask for Melinda, the financial counselor, and we'll get you connected. We'll do what we can to help you understand what that process is so you can revalidate that service. And last, I want to tell you something I am very excited about. October the 15th is when Medicare open enrollment starts, and members have the opportunity to look at all kinds of options that are available, whether or not they choose to stay with traditional Medicare or they look at the Medicare HMO products. It is kind of like Jenny's slides. It's very, very complicated in making a selection as to what is best for you or one of your loved ones when you are making those decisions. There's a lot that goes into it. And so we're going to be having some sessions here in the conference center where we will walk through some of that so you can understand some of the things that are going on. What is Part A? What is Part B? What is Part D? You know, so you can understand some of the things. What is, you know, my pharmacy benefit? What give you some education so maybe you can make a more informed decision when you do select the product that you will use for the upcoming year. So on October the 3rd at 6 p.m., and Brooke will be putting this out on social media later. On October the 5th, we'll have one at noon. On October the 10th, we'll have another one at 6. And on October the 11th, we'll have another one at noon. And this is gonna be done by one of our nurse navigators, Marilyn Calhoun, and she's gonna kind of go through Medicare, Social Security, a lot of those things. So, and she will also set up appointments for you to help you walk through your pharmaceutical benefits. So we will be doing one-on-ones with individuals. If you have any questions, you can contact Marilyn at 276-3629. That's an important decision that a lot of individuals are making, and anything we can do to help you with that decision, we'll be happy to do. And that's all I have.
Thank you. I have administrative reports. Mr. Conley.
Well, sure. Let me just, I think I'm just gonna stand here this evening. So, a couple things just to report on. I know that there's a lot of activity around the construction out at the 16th Avenue and I-75 site. The building is coming along really nicely. It's the completion date is still on track to be the first part of February. All that you'll start to see. I think the brick is going up on the north side of the building. Next week it should be over on the side near the Hampton Inn. So the windows are in. I had a couple of people talk to me about the power is actually on the building, connected to permanent power. So all these things are kind of coming together as the building. It's kind of exciting that more times we go out there and are going over final details about what's where. I had someone ask me about its brick color is kind of a grayish, so is that orange going to stay on the building? And no, the building's not orange. That would be it's a really bad color, but there's going to be an ethos that goes up there. There's brick, there's an ethos coating, and it'll be like a silver or gray or white that'll be up on some of the higher elevations. So, but that you'll start to see that, like the brick will go on first, and then you'll see some of these other exterior surfaces of the building come together, and it'll become more what the color is going to look like, or what we planned for it. But I think the biggest thing that is a little bit of concern is the stormwater runoff is something that we've been working on, believe it or not, over a year. And the requirements are that when it comes one of these 100-year floods, that the water has somewhere to go. That has been planned. So when you put out a parking lot, or you put a building on an area that was ground and the water can soak into the ground, it doesn't do that when you put asphalt and put a building there. So that's what some of the piping. There's a stormwater runoff pond that's just down the street there behind the Bayvine Inn. But getting the piping to that with all the utilities that are buried in Greer Street has been a thing that there's been one thing that maybe it didn't show up on a survey that this fiber optic was here, a gas line was there. Right now there's a water main just right between McDonald's and the building that's going to have to be moved. So sometimes these things cause some disruption. I know I tried to go through the other day, and they were putting pipe under the road. You couldn't cross. You couldn't get all the way down Greer. So that's going to continue over the next few weeks. Hopefully, the long journey on stormwater runoff will be finished. When that's finished, you'll start to see the parking lot be put in, this kind of thing, into the property. So it's going along really well. And if you hear me talking about it more, we've had orthopedic surgeons out there on the second floor looking at what the office is going to look like. We've had most of our department heads that are going to be working in that area. If it's in urgent care, if it's in, I know Ms. Whitney Brown was out there in the retail pharmacy for probably a couple hours yesterday, working with the people who have put in the cabinets in the pharmacy. It's amazing to me the level of detail between cabinetry and electrical and all the things that have to go in. Some of the holdups have been, or that are contingent things, are the air conditioners, again, that were ordered a long time ago. Air conditioners aren't going to arrive till probably the second week in November. And so that creates some level of concern about we're not going to be able to put millwork and some other things inside the building until we get the building air conditioned. So that's expected the second week in November. And then you're gonna put things on the second floor, like the x-ray room out there, having the elevators would be nice. They're not gonna be in until like the second week in December, so you can kind of see there's kind of a plan of how things are going along. But it is on the budget plan as it is, and it's on track as far as the timing it's supposed to be on. The construction project here at the hospital has continued to be planned. This is the expansion of the operating rooms, or renovation, if you will, to create larger operating rooms and to renovate the outpatient admitting area. That planning has been, there's a whole lot of detail when we think about we're going into this hospital that serves hundreds of people every day, so it has to be a very safe environment, clean environment. We have to keep operations going as it happens, so a lot of planning involved with it. And as it is right now, we're still working to, if you will, value engineer. Project is right now as it's we're probably closer to $1 million above where we want to be in terms of the project budget. We are working to get that down before we start. But as it is going forward now, that project would be set to start around, like I say, the third week in December. Let's just go ahead and say January for the construction to start here. One of the early things with that you may see is us creating another parking lot, because it's going to affect the employee parking lot in the back. We're at this point planning to put a parking lot there between where convenient care is and the EMS building. That'll be probably the first piece of, if you will, construction you'll start to see around the site, and that'll probably begin I don't know, say about 6 weeks from now is what I would expect. So those are kind of things going on with the construction that's planned and is ongoing to the facility. I thought it was exciting. You heard Dr. Stevens mention Dr. Cost. Dr. Monet Cost is a new OBGYN that has just come out of residency at Navicent. She's joining the Care Connect group, but I think she's going to be great for the area, and it means that there are 4 OBGYN doctors on staff, and our labor and delivery department is doing amazing things. They're Georgia 5-star, they're baby friendly, and October 19th, is this part of your report? Am I doing that again? October 19th, the Joint Commission will be here to do it's a voluntary certification for maternal care in our hospital. So the whole point is we want to be a place for women and children to be able to come to this hospital and feel safe, and know that we have the highest possible standards for delivery of babies and GYN surgery and this kind of thing. So kind of good things going on there. I've probably got a couple of other things maybe in executive session, but I think those are the high points. I think we've continued to be fairly busy this fall. I hope, like I said, continue to be busy as we go forward. So thank you.
Thank you, Steve. Ms. April Dukes with the Patient Care Services report, please.
Yes, sir. Thank you. Okay, Mr. Gauntney mentioned that on October 19th, we will have Joint Commission here for our voluntary accreditation survey for level 2 maternal levels of care, level 2 for our OB department. We just got approved yesterday for 3 new level 2 nursery beds. What this does is allows us to not just take care of well babies or full-term infants, it allows us to take care of infants born 34 weeks or after. So a big step for our OB department, and kudos to them for the hard work that has gone into this and is going to go into that survey. So we will be able to update you on those results at next month's board meeting. Also, as a result of our culture of patient safety survey and feedback from our frontline staff, I just wanted to update you on a couple of action items that we are working on wrapping up. The first one, of course, we added security to the hospital, but now a level deeper. We're now defining some security policies. One of those policies that we just worked on this week is the code lockdown policy. Code lockdown occurs most commonly when we have a civil disturbance within our community, and the victims of that civil disturbance is transported to our emergency department. If local law enforcement informs us that there is a security threat where retaliation may shift from the community into the emergency room where those victims are, then we go on a code lockdown and we secure the building, secure the patients within the building and our employees. And there is careful attention placed on the entrance of the ED and the other entrances of the hospital in case another person is arriving for emergency care or treatment. So more details on that and education for our staff as we move forward. The second area is the need for a well-defined workflow for a handoff of patients between departments. For example, when we move a patient from the emergency department and admit that patient to South or ICU, NIH data tells us that 80% of patient errors occur during that time of handoff, usually related to information not communicated from one department to the other. So we're adding more information and more detail and defining a workflow process to reduce the amount of errors that could happen in that sensitive time period there to make our patients safer. Just a CHOA update. Our initiative with the Children's Healthcare of Atlanta and Mercer to strengthen pediatric care in rural areas. Our telemedicine cart arrived. It has been set up. We do get trained on that next week, next month on the use of that. The clinical guideline reference manuals are now in the emergency department and copies have been made for our pediatrician's office. And we did submit our list of equipment that will make us more kid ready in our hospital. We should get results on that decision next week at our meeting with the CHOA group. On our community needs assessment, it is our responsibility to communicate the public, and I think Jessica mentioned this too, or no, Jenny did in her quality, but we have a responsibility to educate our community on some of the chronic comorbidities that the citizens most commonly deal with. One of those common illnesses is diabetes. So we're going to start a diabetic education class here in the conference room from 12 to 1. The first one will be October 12th. There is no cost for this. It's free. This group of ladies listed here came up with this idea because they saw a big need of patients coming into the hospital but then being discharged back home, and just with this diagnosis and just not having enough knowledge to manage their diabetes and manage it well. Amanda Smith is my administrative assistant, and she is a type 1 diabetic. She was diagnosed at a very young age and manages her diabetes very nicely, and she's also well educated on the new glucose machines that's now on the market that a lot of people struggle with understanding how to set it up, how to connect it to their phone, how to get the proper alerts to make that piece of equipment help them manage their diabetes as well as they can. Emily King is our registered dietitian. She'll be speaking with the group about healthy food options. Whitney Bridges is our wound care nurse. She will be speaking to the group about foot care and nail care as it relates to the diabetic who may have foot ulcers as a result of their disease process. And Marilyn Calhoun is the pharmacy navigator nurse, and Marilyn will be talking about the different kinds of insulin and their actions and how to safely use and dose those insulin. So we look forward to that class, and we look forward to having the community here so that we can educate them. Information will go out to our physician offices, and we'll communicate this on our social media as well. The last thing is just a quick update on the nursing agency hours trends. In the emergency department, we're a little flat at 67 hours every 2 weeks, but we expect this to end over the next month or so as we get nurses oriented. In the ICU, they did go from 0 previous pay period to 36 hours for the past 2 weeks, but still a downward trend historically there. 2 South has decreased from 265 to 193, so they are definitely still headed in the right area there. And L&D went down to 27.91 hours, and that should be 0 the next pay period because that position was used to fill a medical leave, and that nurse has recovered and returned to work. We're glad to have her back. And that ends my report, unless you have questions. Oh, flu shots. Flu shots are available. The board did get their flu shots tonight, setting a great example for our community. And we want our community to have access to that flu shot as well through our retail pharmacy or our physician practices.
Thank you so much. The clinics and physician services, Mr. Kicker.
Thank you, Mr. Chairman. For the month of August and year-to-date, looking at our volumes year-to-date, 97% of budget, 90% of prior year. We are currently recruiting for ED and hospitalist nurse practitioners that are available on a PRN basis. We are looking for a full-time pediatric physician, and we're also recruiting for CRNAs for our anesthesia department. Just a couple of highlights. In our practices, convenient care on a volume basis, 91% of budget. Pediatrics has been a really bright spot for us for a number of months. They're 113% of budget. Dr. Lane, back from maternity leave, 146% of her volume budget target. Our transportation program, MedPort, which we began back in February last year. To date, we've done 850 patient trips through MedPort. We've purchased our second van, got drivers, and that's really taken off. As I've mentioned several times, Patient Point, which is our Google review or 5-star review program. In 2023, we had a 4.82 out of 5 star. That's 446 5-star reviews and 37 1 to 4 star reviews. So really good progress there. And again, I'll just reiterate, flu shots are available at all of our primary care locations, Convenient Care, Warwick, and I encourage everybody to get your flu shot. That's all I have.
Thank you, Dave. Ms. Vicki Tamer, of the Nursing Homes and Human Resources.
Thank you. I currently have one update for long-term care and one update for human resources. I want to share that Chris Regional Nursing and Rehab had their annual survey on September the 12th through the 14th. We had 7 surveyors for those 3 days. But overall, the survey came out good. So we had 4 areas of concern, one being FTAG 641, which is accuracy of assessments. And basically what they identified, we had 2 care plans, an assessment that indicated that the resident had a restraint. Well, we are a restraint-free facility. So that was an incorrection. That was incorrect from the MDS coordinator that clicked the wrong areas. We were able to correct those assessments on site, but because they were identified, they still go through the plan of correction that we're gonna have to implement. The second tag was FTAG 814, which is disposal of garbage properly. So the regulation states that your dumpster outside has to stay closed at all times. The doors on the dumpster have to stay closed at all times. And so 2 days out of the 3, when the surveyor were going through their process, they noticed 2 times that the doors on the dumpsters were open, so therefore we got cited for that. And just that's a process of continuously just to remind the staff to make sure if you take anything out to the dumpster that you close those doors at all times. The next one was F801, which is qualified dietary staff. So the state has always had in place that each nursing home has to ensure that they have a certified dietary manager to oversee the nutritional services. Well, because the nursing homes are affiliated with the hospital, for all these years we've been able to use the hospital CDM as the oversight. And then she has some management responsibility over that staff. Well, this past survey, they actually pushed us and questioned us on that a little bit, indicating that they felt that we might need a CDM on site for that, for the facility alone, and not someone that governs for the hospital. So, you know, our rebuttal to some of that was that the hospital supplies over 90% of the food for those residents.
And so, we're waiting to try to see what some of the final outcome is going to be on that one. We're hoping at least they will reconsider and accept the qualification on how we feel that we've met it in all the previous years. The other tag was F880, which is infection control and prevention. On day 2 of the survey, they went into one of the restrooms and identified 2 basins that had not been bagged with the resident's name on it. And so that basically is indication that someone else could come in, pick up the incorrect basin and use it. And so we also was able to correct that on site, but because it was identified, they still make that part of the possible plan of correction. And so those were the only 4 tags that we had. We didn't have any areas that was a focus in regards to care. And so overall, it was an extremely good survey. On average, most nursing homes are receiving anywhere from 8 to 10 tags in their survey. So the fact that we're only looking at 4 was a really good survey. The other thing from a human resources standpoint is that I just wanted to share that we started doing what we call pulse surveys. And there are surveys that are gonna be done every quarter. And the goal of this is to really try to get more information on a more consistent basis from our employees, just about what they think about the culture of the organization, and for us to be able to give more consistent feedback about improvements or things that we're looking at to make our work environment a better place. And so the last survey that we had a total of about 52% participation rate, and we focused on 3 primary areas. One was communication, one was teamwork, one was mission, and then we did ask about, were the employees receiving the information from their previous engagement surveys. And so when we looked at and asked employees, did they feel like they were able to carry out the mission of Chris Regional Hospital, we had 93% of those employees that said they felt like that the job that they were doing every day, that they were carrying out the mission that we had as our organization. And I think that's extremely important, because I always tell my new hires when I do orientation is, why did you say yes to be employed at Chris Regional? And we talk through that mission statement and actually what it means to them on a granular level, because sometimes you can have a mission statement, but how do you really connect to it? And I just really try to remind them that they impact quality every single day, and that's what our mission statement says, is that we're gonna provide appropriate quality care. And so it's great to see that the employees feel like they are connecting to the mission and what we say we're here to do. The other thing was kind of how well the departments in the organization work well together. And that was probably the lowest ranking one, which is 84%, but not extremely bad at all. It kind of goes back to when April was talking about a culture, a hospital with a patient safety culture, and that the departments were working together with handoffs to make sure that the communication was good between departments. And so this kind of shows that there's a little bit of a work that can be done in this area, and so that we can assure that when we're moving our patients, or even when we're communicating the needs from one department to the other, that we're doing that in a way that is cohesive and that it creates great outcomes for whatever it is that we're trying to do. The other area was that I would recommend my family and friends to this organization. 94% said yes. I always tell people, why do you want to work somewhere that you wouldn't want people that you love and care for to come? And so that the fact that 94% of our employees said yes, I would recommend the care. And then the last thing is there a climate of trust in your department? And 90% said that it was. And anytime you do something, I think it's extremely important that you trust the person that you work beside, you trust the services that's happening within your department, that you're giving to the community. And so the fact that we can come into an environment and feel good about what we're doing every day, I think it speaks volumes to just the work that is being going on. So we will have another survey coming up in the month of October, and we hope that we continue to see good results and that our employees always continue to feel good about what we do here in this organization. Any questions? Thank you.
Thank you, Vicky. And lastly, Community Relations Foundation work from Ms. Brooke Marshall.
Thank you, Dr. Pennell. I'm just gonna hit on a few things that we've had going on at the hospital, just a few highlights with our staff. Our EVS team, worked hard throughout the hospital daily. We recently celebrated EVS week. Lynette celebrated her team all week, and they ended Friday afternoon with a little party out in the back, and they just had a lot of fun. And you know, they take care of all the patients' areas, and they're being the front line of infection prevention. So thank you for all you do. As both April and Dave hit on, we do have flu shots available. Flu shots can be received at our pediatrics office, our convenient clinic, Dr. Natty's office, Dr. Holloway, the Warwick Clinic, Chris Family Medicine, which is Dr. Lane, and you can also get them at the retail pharmacy. And there's no appointment necessary, and you can call to get more information about that, but they are available. We also celebrated a milestone with our 1,000th robotic surgeries. We're proud to provide these robotic surgeries to the community. Our robotic surgeons include Dr. Alicia Register, Dr. Vince Culpepper, Dr. Barry Igabadia, and Dr. Brandon Siegel. So congrats to them, our docs and the OR team for hitting that milestone. I would also like to say thank you to the Chris County softball team who recently donated $1,000 to our oncology department. And on top of that too, Run for Your Lungs is hosting their 13th annual run coming up November 7th. Always a great event. They do a lot for our oncology department for our lung cancer patients. So if you have time, we would love to have you out for that. Also, Chris County Power is hosting their first annual charity golf tournament fundraiser for breast cancer. And the proceeds from that are going to benefit Chris Regional's oncology department. I've seen on social media, you can go on our social media page, you can go on the chamber, but they still have spots for teams, they still have spots for sponsorships, and it's next Friday, October 6th. So you can contact us, you can contact the Power Commission, and we would love to have anybody and everybody out for that. We continue to sign people up for MyCrisp, which is our new patient portal. You can find our providers, schedule appointments, pay your bill, and access your patient information using the MyCrisp. And this week, we have kicked off, it's not live yet on the patient portal, but the new pharmacy program. So that's going to be interfaced with our patient portal, and you're going to be able to go on and refill your prescriptions. It's got a point of sale, but just a lot of great features for our patients. And just switching gears to the foundation, tax credits for 2023 are still available. As long as they have it, the applications are there. If you're interested in this program, please contact me, one of the board members, Jessica, Mr. Gautney. But on October 4th, we go live with 2024 applications. So you can either contact me for that, or you can go onto the Georgia Heart website. And as Jessica said, this has still been a very beneficial program for our hospital, and we are very grateful and thankful for everybody who's participated in that. So that's all I got.
Thank you, Brooke. If you enjoyed me right before we discharged before we adjourn, Cindy, would you give us an update on your Learning Academy of the School Board of Virginia, Early Learning Academy?
Yeah, it's gone great. We're actually maxed out right now. We have a waiting list. So we're exploring that list to see, if there's anything else we can do as far as opening. But it's gone really well.
How many children is there?
Total, not 100, 80 something, I'm not sure, at last count. So I haven't gotten an update this week, but it's going really well. We're working on going through the quality rating process, which is something we didn't have to do prior to opening because we're a governmental agency. But we want to go through that process so that we are able to accept CAPS.
We're really proud of you and the school board. Okay. I hear a motion to adjourn, and there's other things to go before the open meeting. Do you need a
I would like to have an executive session.
motion to move into into an executive session. We'll take about a 3 or 4 minute break.